We have the pleasure of having today Claudia Capa. Claudia Capa, she is our senior advisors on statistics and monitoring. I'm sure many of you know her. She has been in UNICEF for many years. She has been doing wonderful publications and studies and analyzing data on violence against children. We have been working in the last year. She was part of the core of the International Classification of Violence Against Children that we want to start to implement, and we will have, we hope, funds soon to start to implement it in West and Central African countries. So I will give the floor directly to her as she has to run later. So Claudia, to you, and thanks a lot for joining us, even you are traveling now. Thanks a lot.
Thank you so much, Esther, for the very warm introduction. Thank you for the opportunity to present the work that we are doing related to the implementation of the International Classification of Violence Against Children. Today, I want to zoom in on the measurement of technology-facilitated violence against children. With the initial discussions around what do we mean by measuring technology-facilitated violence against children, but what is a form of technology-facilitated violence against children? And these might sound a rhetorical questions for those of us working in the field, but when it comes to collecting data, having clear-cut definitions is the backbone of solid statistics. In 2018, UNICEF convened a number of different statistical offices across the world. The country of Ghana, the National Statistical Authority of Ghana, was also present in these conversations. And one of the things that emerged from the discussions with the national statistical offices of the 40 countries that were represented is the fact that many countries were confused about how to clearly define and measure violence against children. From a statistical perspective, how do you count cases of violence against children in a way that is comparable across countries, but more importantly, within countries, so that the same child is classified as a victim of violence, regardless of the entities who is providing services, for example, and then the same child get captured by statistics on the prevalence of violence against children. It was in response to this need to have clear operational definitions of violence against children that UNICEF, in collaboration with over 200 experts, developed the International Classification of Violence Against Children, which is the first ever international classification in the field of violence against children, but more broadly is the first ever statistical standard when it comes to classification of issues related to children and child level indicators. It was built on the basis of other classifications. Obviously, we want to build on what has been already regulated in the field of statistics. In particular, the ICVAC was built on the International Classification of Crime for statistical purposes and other statistical standards. Obviously, because not all forms of violence against children are considered a crime by many legislation, it was necessary to develop a dedicated classification that focused on violence against children. This classification was approved by the United Nations Statistical Commission in March of 2023. The United Nations Statistical Commission is the highest governing body regulating statistics for member states. And once something is approved by the Statistical Commission, it becomes an official international standard that countries are expected to follow. So 200 individuals contribute over 87 different organizations, including 43 national statistical offices, and I wanted to list them here, so give visibility to the significant contribution that was given by the different statistical office throughout the development of the international classification of violence against children. So we had 15 government agencies in addition to statistical office. We have 15 academic institutions. We have 3 civil society organizations, 7 international organizations, and other partners, including ECPAT International that I see represented here. So according to this classification, we have developed a definition of violence against children. Violence against children refers to any deliberate, unwanted, and non-essential act, threatened or actual, against a child or multiple children, and these acts results in or has a high likelihood of resulting in death, injury, or other forms of physical and psychological suffering. So for an act to be considered an act of violence, it has to contain these 4 characteristics: being deliberate, being unwanted by the victim, being non-essential, meaning it's not an act that is critical for the survival or fitness of the child, and needs to be harmful. Now, on the basis of these 4 characteristics, and depending on the nature of the act that is perpetrated, the classification goes on to regulate and define different forms of violence against children, starting with violent killings, for which we provide definitions and criteria for classifying cases of violent killing of a child. Then the classification regulates and defines physical acts of violence against a child, from severe assault to minor assault, for example. There is a dedicated section of the classification that regulates the classification and definitions related to sexual violence against a child. Then we have a section on psychological violence against child, and then a section on neglect of a child, which is part of the definition of violence against children. So the classification was developed to be the overarching framework for classifying acts of violence against children. But we started to develop dedicated in-depth briefs that regulate specifically certain forms of violence against children. The first of such briefs was dedicated to clarifying concepts related to technology-facilitated violence against children in a way that is consistent with the ICVAC. So after, again, long deliberations and application of concept, we landed on a definition of technology-facilitated violence against children that make reference to any act of violence against children, defined, as I mentioned earlier, as per the ICVAC, that is perpetrated in part or fully through the use of ICTs or other technological tools. So as you can see, this is a broad definition that actually encompasses 3 different types of acts. First of all, acts that can only be committed through the use of ICTs or other technological tools. And this includes, for example, unwanted sexting, live streaming sexual abuse of a child, or cyberbullying. Okay? The nature of the act is such that this act can only be committed through the use of ICTs. And this is the first categories of technology-facilitated acts of violence against a child. But within this umbrella, under this umbrella term, there are also acts that can be committed in person or through the use of ICTs or other technological tools, so, such as, for instance, harassment through messaging platforms or threatening to kill a child via social media. So as you can see, there can be of different nature. This act can be, some of them are psychological forms of violence, other are physical forms of violence. And this act of violence can be committed in person or through the use of ICTs. So obviously the ICTs play a significant role, but is not just committed through ICT, it can also be in person, but through the use of the ICTs and other technological tools. And the last category of acts are acts that occur in physical spaces, okay, but are perpetrated through the use of ICTs or other technological tools, such as, for instance, leveraging drones to inflict physical harm on a child. So the space is physical, it's not an online space, it's a physical space. And then there is the use of ICT. So one of the things that is critical to understand is that There is an intersection, of course, of technology-facilitated violence against children and online violence, for example, but technology-facilitated violence against children can be broader and is broader than online-only violence because it can also be perpetrated in physical spaces, not just online spaces. So I just want to conclude my intervention by talking about, okay, so what? So we have this framework, we have these guidelines that provide clarity on how to collect data to account for and calculate, for instance, the number of children who are victim of technology facilitated violence. But how does this in practice operate? Right? Because this is guidance. This guidance needs to be integrated into statistical plans and into the data collection mechanism of the countries. Because this clarity on definition is critical not just for surveys, it's also critical for administrative records, right? This is a clarity that needs to be happening at the conceptual level and then needs to be translated into data collection tools, meaning questionnaires, for example, forms, that are then used in administrative data collection processes or through household surveys. And there are 4 steps for an implementation roadmap of the ICVAC and, for instance, the ICVAC compendium of tools. First of all, there has to be a national working group that is created at the national level because data on violence against children comes from different sources and entities. So it's fragmented as a sector in terms of response, but also in terms of data. So creating a working group is the foundation of then a second step, which will be the assessment of the data production mechanism that exists in a country to see what are the gaps, what are the constraints, and possibly who are those responsible for addressing the constraints and the gaps that exist. It's not just the national statistical authorities, okay? The national statistical offices have obviously a big accountability around data, but there are other line ministries, for example. So they all have to come together to do an assessment of the data production and constraints using the ICVAC as the framework to evaluate data gaps. On the basis of this evaluation of the data gaps and constraints, the National Working Group needs to design a work plan that identifies the steps, the activities, the outputs, and the actors that need to be responsible for producing the data that are currently missing. And of course, there has to be an implementation, the National Work Plan. This would lead to obviously data production and dissemination. So it's a complex roadmap. It involves several steps, but this is what becomes transformative. Violence against children data needs to have the same level of systematic investment that governments reserve to other type of indicators and statistics, such as the GDP, the employment statistics, the poverty statistics. So unless we aspire to elevate the production of data on violence against children to the same level of these other statistics, we will not be able to influence statistical plans and transform the field of data when it comes to violence against children. So I'm going to stop here because I want to also to be mindful of other speakers' time. And thank you so much for your attention.
Thanks a lot, Claudia. We know you are running, and we really appreciate you have taken the time. If there's any question, we will come back to you for sure. And yes, I think it set the tone of the importance on data. Also, on a new issue for many countries in the region as is online violence. It's an issue that Ghana, for example, that it's supporting all these webinars is ahead, but we have many other countries in the region that have no data at all. That's something we are fighting to have some data. And it's really important that since the beginning, all countries, all the statistical office that are going to engage with ICVAC also take into account the importance of having data on online violence, given that it's growing and we know how internet is entering African countries, and it's the younger population in the world. In the following years, the younger population in the world will be here. So we really need to make attention to this issue. We will be in touch with you, and if there's any question, I will come back to you, and we will share the presentation and they back with everybody on this call and with others that couldn't join today with the recording. So thanks a lot for your time, and we will be in touch for sure. So we will now continue with the other speakers. First, I want to apologize. We have also, as I say, since the beginning, we are organizing these meetings with SAFE Online, these 3 webinars that we already have this year, and I hope we will continue this community of practice because there's a lot of things in these changes that are coming up. So we have the pleasure of having today Miguel García Ejido. Bienvenido from SAFE Online. She's the fund chief, so I will give him the floor before we move to the other speakers. And I would like to remind everybody that we have interpretation. I put it in the chat. So we have French, English interpretation for those that need. Chers collègues, on a l'interprétation anglais-français pour ceux qui ont besoin. Je l'ai mis dans le chat, mais s'il te plaît, si vous avez besoin, là, vous pouvez choisir dans le petit monde qu'il est là, l'interprétation en français pour nous suivre. So with no more delay, and also just to let you know, if there's any question for Claudia, please put it in the chat or do it later. I work closely with her, so I will try to answer. If not, we will give it to her. So no problem with that. And thanks a lot for your patience. Please go ahead, Miguel. Thank you.
Thank you so much, Esther and UNICEF colleagues, and congratulations to Claudia and the rest of the data team at UNICEF for a fantastic work that you are doing. Very interesting presentation. My name is Miguel Garcia. I'm the SAFE Online Fund Chief, and we have been supporting UNICEF Ghana in this endeavor of building evidence and scaling up their interventions since 2023, and this is part of this regional workshop, is part of the support that we are providing to UNICEF Ghana. And as mentioned by Esther, we have been supporting UNICEF Ghana in the previous years as well, and we saw Ghana as a country that could be foreseen as a model for the West and Central Africa region, but also other parts of Africa, as a model and as a pilot, because of the good work that they have been delivering in conjunction with the government in the last few years in the fight against online child sexual exploitation and abuse. SAFE Online is a fund that is globally invested in fighting against online child sexual exploitation and abuse. We have a portfolio of $100 million investments to date, and roughly 25% of those like $100 million have been invested in research and data, because for us it's key to know what we are investing for, what are the latest trends and patterns in the fight against online CSCA, so that we can target our investments in a way that is able to maximize the impact of the donor contributions that we receive from different donors from around the globe. This is why we consider this particular line of action, the generation of evidence and data, as well as the knowledge exchange that this webinar represents, as a key part of the investments that we deliver, and one of the best ways of trying to maximize the impact of our investments. Today, we have here with us not only a good representation of different countries. I can see colleagues and experiences to be told from Namibia and other parts of the Africa region, where we also that are also like part of our investments, but also colleagues from other organizations that we are currently supporting, such as ECPAT, with the work they are doing on disrupting harm, which is our research and data flagship initiative. You will hear more by Andrea on this particular initiative, as well as other colleagues like Child Helpline International, that we are also supporting their helplines in 7 different countries in Africa. I want to also reinforce the idea that for us at SAFE Online, the generation of evidence and data is key at this particular moment, because of the rapid technological developments. Only by investing in data generation and research and data, we can know what are the latest threats and trends in a very rapid and changing environment, facilitated by the cutting-edge technologies that are now on the top of everyone's mind, artificial intelligence, etc. But also in the current landscape of scarcity of resources. Only by investing in data and knowledge, we are going to be able to target our investments in a way that is like very effective, in a current landscape where funding has been like cut across the board for many organizations, including ourselves, and also as a way to be able to mobilize more resources. Only by knowing what's going on in the ecosystem where we are moving on, we will be able to be like more effective in mobilizing resources, advocating for online CSCA or technology facilitated violence against children, so that it can be like on the top of the public agenda, and also be part of the resource mobilization efforts that we do, and also as a way to share responsibilities by knowing like who can be responsible for certain parts of the action, and be able like to also like coordinate together better with different actors that need to play a part in the fight against technology facilitated violence against children or online CSCA. That's all from my side. I'm very happy to hear today's experiences from different countries in West and Central Africa, as well as other parts of Africa led by Ghana. So over to you, Esther, and to the rest of the UNICEF colleagues.
Muchas gracias. Thanks a lot, Miguel. So we will move now to our panel. And as you know, today we are focusing on generating and using data, and also on evidence through research. As Miguel was explaining, they have supported different countries in Africa on this. Ghana is an example from the West and Central African region, but we have here also the government of Namibia that will tell us about their experience, that have been also supported by Safe Online. First, we will have also a presentation by ECPAT that have collaborated with UNICEF Innocenti. Then we will have the government of Namibia. So to start, I will give the floor to Andrea Barella, who is the project's lead at ECPAT International. She's based in Bangkok, Thailand. And she joined ECPAT in 2016, following a short assignment with the United Nations Interregional Crime and Justice Research Institute. So I think we will have the pleasure to hear about this joint work that has been done for years in several countries and the research and data they have get. So please, Andrea Barella, to you. Thank you.
Thank you so much, Esther, and thank you to the UNICEF Ghana and the West and Central Africa Regional Office. Hope you can hear me well. I'll share my screen in a second. In the meantime, while it comes up, so I will be sharing a little bit from Disrupting Arm. Disrupting Arm is a research project which is implemented by ECPAT International, UNICEF Innocenti, and Interpol, and is funded by Safe Online, as Miguel was mentioning before. So the Disrupting Arm project is a project that aims at generating evidence on technology-facilitated child sexual exploitation and abuse in different countries around the world, and using a multi-method approach. So gathering information from children directly, from survivors, from government representatives, frontline workers, and so on. So I need to start my presentation by saying that the data I will share is about Eastern and Southern Africa, and that at this moment in time, we are not conducting or planning to conduct Disrupting Arm in West and Central African countries. However, we really think that it's important to see how data that might be pertinent and specific to other countries can reflect and resonate with colleagues that are based in countries outside the region of focus of our research, and also how that data can stimulate recommendation that might also be applicable to other countries despite the current lack of evidence and data in one specific country. So I would encourage all participants to try to also look at the data from the perspective of where they're coming from and whether they feel some that they will be hearing might be resonating on, with what they know about their country context, and what can be actions that can be taken already based on what Disrupting Arm has recommended for the specific countries where we have been working on. So when it comes to the specific data on Eastern and Southern Africa, we look at 7 countries specifically that you can see on the screen. So Ethiopia, Uganda, Namibia, South Africa, Mozambique, Tanzania, and Kenya. The data that I will present, though, will not specifically refer or include South Africa, as the methodologies that we used were slightly different, and so we did not include them in the aggregated data that I'm about to present to you. So first of all, we look at, of course, at the number of internet-using children, so children aged 12 to 17, who were subjected to some form of technology-facilitated child sexual exploitation and abuse. We calculated this by asking children through an household survey whether they had been subjected to at least one of the following instances you can see on the screen. So being offered money or gift in return for sexual images or videos, being offered money or gift to meet in person to do something sexual in nature, someone sharing sexual images with the child without their consent, or someone threatening them or blackmailing them to engage in sexual activities. So based on Disrupting Harm data, more than 1 in 10 internet-using children in the 6 African countries had been subjected to at least one of these forms of tech-facilitated child sexual exploitation and abuse in the year prior to the survey, which refers to 2021. The most common form of sexual abuse in the 6 countries was being offered money or gift in return for sexual images or videos. And you can see that the average is 11%, but this goes from a max of 18% in Uganda to a minimum of 4% in Tanzania. For Disrupting Harm, it's very important though to clarify that we are not attempting to do any comparison across countries in terms of which one is better, which one is worse, but really look at similarities and differences that can help us understand better how to prevent and respond to these crimes. Looking a bit more specifically to some forms of tech-facilitated child sexual exploitation and abuse, you can see on the screen, we also asked children if in the year prior to the survey, someone had made sexual comments about them that made them feel uncomfortable. With sexual comments, we are referring to jokes or stories or comments about their bodies or appearance. And just to clarify, sorry, I missed it before, we're talking about a sample of around 6,000 children because it was approximately 1,000 children per country. When looking at non-consensual sharing, we have very similar percentages when it comes to the percentage across the different countries. And we are referring, of course, to the sharing of sexual images without the consent of the child. And then finally, looking at the one that I shared was the most common for the 6 countries in Eastern and Southern Africa, so accepting money or gift for sending sexual images or videos, you can see again, we have a top 10% in Uganda and then a lower rate in Tanzania with 2%. Of course, this can be highly linked with social stigma, but also underreporting and lower disclosure due also to the sensitivity of the topic. Through the Disrupting Harm study, we also look at where technology-facilitated child sexual exploitation and abuse happens the most, keeping in mind also what Claudia was sharing before about the understanding of this type of exploitation as something that can happen fully online or also through the interactions that are both online and in person. So across the countries in Eastern and Southern Africa, most of the instances of tech-facilitated child sexual exploitation and abuse happen on social media platforms, in particular Facebook Messenger at 65%, followed by WhatsApp and then Instagram. Also TikTok and Twitter, X now, were featured in children's responses, but to a much less lower frequency. Of course, this can also be related to the fact that these are the most known platforms, but they are also somehow reflected in the accounts of survivors that were interviewed during the project. When it comes to disclosure, we also ask children who they disclose to when they were subjected to the abuse or exploitation. And I'd like to clarify that for Disrupting Harm, it plays quite a big difference between the disclosure of the abuse and the formal reporting through law enforcement and the justice system. This data you see on the screen is about all countries where Disrupting Harm for now has been completed, which are 13, 7 in Eastern and Southern Africa and 6 in Southeast Asia. And on average, 34% of children who had been subjected to abuse did not tell anyone at all. Those who did tended to disclose to their mothers, friends, or their siblings. And almost no one went directly to an hotline or to the police, at least from the sample that we had. When we asked them why they decided not to disclose, many of them refer to sense of embarrassment, which was one of the highest across most of the countries, but also the fact that they did not go where to go to. Another very important element that was observed throughout all the countries where disrupting arm took place was the sense of victim blaming, and this feeling, especially in cases of abuse based on self-generated sexual content, that they would have been blamed for somehow having been active in the abuse that they had experienced. When we also try to look at what are some elements that may be at the basis of the prevalent child sexual exploitation and abuse online. And of course, we saw that knowing how to navigate the internet safely would be very important in preventing this type of exploitation. Of course, this is not about putting the burden on children to protect themselves, but it's very important for them to learn how to avoid or reduce the risk of harm that they may encounter online, and especially know where to go in case something happens to them. You can see that we asked children if they had received any information on how to stay safe online, and a majority of child internet users across the 6 countries and not received any sort of information. And even in cases where they had received this information, of course, it's not possible for us to determine in full whether this education was evidence-informed, it was of high quality, included information, for example, also on consent, boundaries online, and so forth. So we also look, of course, at the legislative framework and how this criminalizes the different forms of child sexual exploitation and abuse facilitated through technology. I wanted to clarify that what you see on the table refers to the legislative framework at the time that the Disrupting Harm report for Eastern and Southern Africa were completed, so 2022. So there have been welcoming some changes across legislation across the 13 countries where disrupting harm took place. When it comes to grooming specifically, I also wanted to mention that one of the important elements when it comes to next steps is also the alignment of the legislation on technology facilitated child sexual exploitation and abuse with the new United Nations Cybercrime Convention that was adopted just in December last year. And that sets new international standards on many of these crimes, grooming in particular, recognizing it as a crime, even in cases where there is no in-person abuse after the grooming behavior, which is, of course, a reflection of what actually happens in practice. Many of the countries in Africa have already signed the convention during the signing ceremony last month in Hanoi, and of course there is a hope of very soon ratification to bring the legal framework in line. From Disrupting Harm, as I was saying at the beginning, we also have as one of the main partner Interpol, and they look at the role of law enforcement when it comes to this type of crimes, and some of the main findings were related to the importance of specialized police units that of course need to be resourced and trained to be able to support children, and also the importance of connection with the Interpol International Child Sexual Exploitation Database that allows for collaboration across countries. When it comes to justice system, we did see in general some difficulties when it comes to bring the case to justice, and also the use of complex language and proceedings that were more difficult for children to fully understand. In many cases, children talk about re-victimization. You can see, for example, in this quote on the screen, also how this young survivor from Uganda felt about the support she received from law enforcement, and how she felt she was blamed for doing such a thing and for having behaved in a certain way. We also do have a lot of promising examples, though. So cases where children were fully informed about their rights and how this really changed their experience with the justice process. You can see this is explained by a caregiver of a young survivor from Kenya. And also appreciation for the possibility to choose the gender of the professionals, and the possibility to choose, not automatically female for girls and male for boys, but really seeing what would be the best for each individual child. Disrupting Harm, of course, for each country, we collected a few recommendations, and in this slide, I just tried to put together those that appear most commonly across all Eastern and Southern Africa countries. So our first one was related to national scale awareness and education programs about child sexual exploitation and abuse, which of course also reflect in the second one on the importance of informing children about the right to be protected from all forms of physical, sexual, and mental abuse. We have a recommendation, of course, to amend the legislation that now also includes as international standards the Cybercrime Convention of the United Nations. And then we included the importance of increased awareness about the important role that hotlines and helplines provide. We were mentioning before, few children did report to hotline and helpline, but in most cases, this was also due to the fact that they did not know that they could access such a system, and also that such a system can also be used when a child receives a disclosure from another child and needs support in understanding how to respond to that disclosure by a friend. And another recommendation is, of course, around training for all professionals, especially within the justice system, that come across cases that come across, children who have been sexually abused and exploited online. Since the launch of Disrupting Harm, we have, of course, seen a lot of promising example of progress, and I know that colleagues from Namibia will share a bit more. I just wanted to share, just as an example, the adoption in Kenya of the National Action Plan to tackle online child sexual exploitation and abuse, as well as some legislative amendments in Tanzania Cybercrimes Act and the Children's Act that are aimed at bringing the legislation in line with the international standard. And then just to conclude, I wanted to share that Disrupting Harm is not over, but we are currently working on its second iteration, looking at 12 additional countries in 4 regions in Latin America, Eastern and Central Asia, Eastern Europe and Central Asia, Middle East and North Africa, and in South Asia. We will be soon starting to release the reports, but I just wanted to mention that something that we are seeing across those countries is related a lot to the issues of stigma and shame, and also this idea that the way that children see barriers to disclosure is very influenced by their gender. So in general, through Disrupting Harm, also Disrupting Harm in one, so for Southeast Asia and Eastern and Southern Africa, we did not see very big differences when it comes to boys and girls that were affected by this specific type of exploitation and abuse. In the new iteration of Disrupting Harm, we are seeing, though, that there are more gender differences when it comes to barriers to disclosure. For example, boys having fear of stigma because they're expected to handle it up by their own, while girls may fear more victim blaming, especially when sharing their own images. One overarching point that we have, I think, across all countries is how this feeling of discomfort and shame can make children reluctant to speak up and allow perpetrators to take advantage of their situation. And so how it's key for us to foster an environment in which children feel comfortable having conversation about relationships, boundaries, sexuality, consent, and reaching out to adults, professionals, helpline and hotlines when something happens to them. And with this, I hope I didn't go over time, but I'll pass it back to Esther.
Thanks a lot, Andrea. Thanks a lot for all the information you have shared about the different work you have done in Africa, but also I think it was really important the part regarding laws and how laws have been advancing in different countries. And I think that's something that it's also really important when we talk in our first webinar, specifically on laws and the need to have specific laws for online violence. So thanks a lot for all the data shared. And now we will have the pleasure of hearing from one of the countries you were talking about previously, Miguel, too, that is Namibia. So we have the pleasure of having with us, and sorry if I don't pronounce properly, we have Rahimisa Kamui-Ngona. It's the Deputy Director from the Ministry of Gender Equality and Child Welfare. She's a social worker by profession with 15 years of work experience, and she completed a master's in public administration on top of the degree in social workforce. So we will be hearing from the example of Namibia, which is a great pleasure to have you here today. Please go ahead. Thank you.
Thank you very much for the opportunity. As Namibia, we were really excited to be part of the Disrupting Harm study, and also the the changes that came as a result of that study. We have really worked hard as a country to incorporate the recommendations from the study to inform some of our approaches in terms of responding to online harm and online abuse that children experience in the country, and as well as offline. Just to give a bit of context, we recently concluded our census, and Namibia's population is now stands at 3 million, and of which 1.2 million is represent children. So we are still a relatively small country, but our challenges are similar as in other countries. From the findings of the Disrupting Harm study, we have learned a lot. We have, for example, learned that there's children are really utilizing the internet and the digital space, but there are a lot of risks that they face, which parents are not aware of. For example, from the study, we realized that 9% of the children that participated in the study have been exposed to harmful online content, and we have also seen with the cases that our social workers are dealing with that this is really becoming a problem. Some of them have received requests for unwanted for photos. They've received unwanted requests for photos. They have been offered money. They've also been exposed to images of sexual images online. They have been asked to share images of themselves, either being naked or participating in unwanted activities. What we have seen also is that there are gaps in terms of reporting. Of course, like in other countries, even if children have experienced, sometimes they do not report or they do not know where to go to report. And also the gaps between the reporting and the investigation is also a bit of a challenge. Even if they report at times, if, for example, if the incident happens in a remote area, sometimes the service provider who needs to respond is also not aware of how to do it. So those are the gaps or challenges that we experience as a country. We need to do a lot of awareness raising. We need to build a lot of capacity for all the stakeholders, and we have started doing that as a country. And from that context, or from that the findings of the Disrupting Harm study, a lot has happened as a country. We have what we call the Child Online Protection Task Force that drives the coordination of all the activities within the country, whether it is from the industry perspective or from the civil society organization or government. But the idea is we as government acknowledge that we cannot do it alone. Thus, we leverage what we already have on the ground. We have the model that we use, for example, for the gender-based violence response units. And we thought that instead of using or coming up with a new model, let us leverage that, and let us then enhance it and build the capacity to make sure that we are also able to respond to online abuse of children. So Disrupting Harm for us has really opened our eyes as a country to realize that we also have to be aware of these new dangers, but let us also use our existing models and strengthen them to address the new issues that are coming up. So moving on, what have we done? I've been speaking about what we have done as a country. The key achievements, of course, is the establishment of the specialized Auxerre unit within the police, the Namibian police. There's an Auxerre unit that is established that is victim friendly. And the good thing, again, I said that we have leveraged our existing resources. So this unit is coupled to our gender-based violence response unit. They have used the awareness or the capacity that was already existing within the police to set up a specialized unit just for OCSEA. We have also looked at our referral pathway, the existing one that we use within the case management, and we have looked at how we can incorporate OCSEA within this pathway so that we do not miss the cases of OCSEA that are being reported. So there is a specialized referral pathway specifically looking at online and offline abuse, not necessarily just for online. We continue to build the capacity of the Namibian police, the justice actors, specifically focusing on how to work with children, making sure that child witnesses are able to really give the necessary evidence, and the police are able to get the necessary or required statements and evidence to prosecute such cases. So we do what we call multi-stakeholders trainings, where you will have, for example, a prosecutor, a social worker, and a police officer, and a magistrate in one training, just to raise that awareness of what is OCSEA, how should we approach these cases, and how do you work with a victim who is a child. So we in that way, we are strengthening coordination in terms of investigation, in terms of prosecution, as well as providing psychosocial support to the victims. We continue to do awareness raising, of course, especially with our civil society organization. Namibia has also worked within the Ministry of Education to incorporate OCSEA within the curriculum to make sure that children at that level also understand the dangers of online abuse. We are looking at reviewing the proposed cybercrime bill to incorporate the provision of the sexual exploitation bill, and the idea is just to strengthen the proposed provision of the cybercrime bill with what we have initially proposed in the sexual exploitation bill, and we are hoping that that will be comprehensive enough to really lead to prosecution of perpetrators. We have also worked on developing IEC materials, making sure that people understand online. Within our parenting manual, we've also included components of online child sexual exploitation. As I indicated, parents are really not aware of the type of dangers that their children are experiencing online. So we have worked hard to make sure that within the parenting manual, we have included OCSEA materials. Of course, we work with the Lifeline Childline. They are running a radio called Uitani Radio, and the idea is that children are leading the broadcast to make sure that they raise awareness from their perspective on some of these issues. And of course, we have the toll-free numbers from Lifeline Childline. The ministry is really supporting Lifeline. What we have done with Lifeline also as government is to designate them as a child protection organization, meaning that their social workers are now able to provide the same function as government social workers, and this makes it easier for them to receive not only reports, but also to take these cases further as well. And finally, what we have learned from these is that data is critical. Data is needed for us to really design programs that are targeted, that are not generic, that help us to zoom in on the issue. And of course, we will continue to work with our stakeholders to coordinate issues of OCSEA, but also making sure that children get involved in the process. And we also want to say that we invest early in reporting and referral mechanisms and digital literacy to reduce long-term harm through, for example, investing in radio programs that the children are managing through Lifeline Childline. Thank you very much. That was my intervention.
Thanks a lot. It is great to hear from Namibia and all the steps you have gone already. Congratulations. And I think it's a great example for many of the colleagues that are here. We will keep exchanging, I am sure, between different countries. And you have mentioned also the child helpline you have, and we will have now the opportunity to hear from Helpline International, Child Helpline International. So we are going to see how leveraging on data from helplines to inform policies and programs too. And we will have the chance today to have two persons from Child Helpline International. We will hear from Helen Manson, who is the executive director, as I say. She's a passionate advocate for the work of child helplines with over 18 years in the sector and 25 years in senior management. She's now leading Child Helpline International. And we have the chance also to have Dr. Anastasia Schuster, who is the Senior Manager of Data and Research at Child Helpline International. And in her role, she oversees the collection and analysis of data from child helplines around the world. So as you know, there are child helpline members in 132 countries and growing, many of them in Africa and growing little by little in West and Central Africa. So it is a pleasure to have you both here today. So the floor is yours and we will hear from you now. Thanks a lot, Helen and Dr. Anastasia.
Thanks, Esther, and thanks to all the previous speakers. It's absolutely awesome to be with you today. Thanks to Miguel, thanks to Andrea, and indeed, I'm together with my colleague Anastasia Schuster. And we have some slides for you. And before we launch into the slides, I'd just like to thank Ramahisa for your excellent presentation as well. It's amazing to see the work that you're doing also in supporting Lifeline Childline Namibia. And I think a great example of how the Child Helpline is indeed a strong service provider in terms of response to online child sexual exploitation and abuse. So we have some slides for you, as I say, and I think important to say as well that it's clear already from the previous speakers around the intersections of our work and how the Child Helpline indeed is an intersecting service within the response to child online protection, also in terms of the work we saw from Andrea around disrupting harms and how child helplines present a huge opportunity also in the West Africa region. And so we do have some members in West Africa, and we don't have members across the whole region, and we're very much focused on working with UNICEF and the different governments in starting child helplines in every country of the world. So indeed, West Africa is an important region for us as well. I'm going to launch into the slides, and I'm going to take you through the first couple of slides quite, swiftly, as we're under some time pressure. So I'm going to start with a quick overview. As Esther has mentioned already, we are a network organization, the global network of child helplines working around the world. And we currently have 30 members in Africa. And you may well have realized, from the presentation earlier on Namibia, that these organizations are positioned as an entry point into the child protection system. Across Africa, we're also very proud that there's a harmonized number. So those children and young people that are calling through telephone and voice are using the harmonized 116 number, which is assigned in 24 African Union member states, a really important characteristic of what we do across Africa. We're advocating for the rights of children and young people, and we are supporting the creation and strengthening of child helplines, working together with our members like Childline Lifeline in Namibia. And we really exist to enhance child helplines recognition as an essential part of child protection systems. We're doing this in terms of collecting data from our members, building capacity, investing in technology, and also in terms of evidence-based advocacy to convince all of the different actors in the systems that protect children of this aspect of this very important, essential tool of giving access to the child protection system with a low threshold and easy to access child helpline. Quickly looking at the role of the Strong Child Helpline. So you can say that a child helpline is a professional service that children and young people can contact about any issue, including child sexual abuse. And of course, that also includes technology facilitated child sexual abuse, as we refer to it now. In terms of the characteristics, going a bit deeper, we'll talk about the accessibility, which means free of charge via multiple methods of contact. And I think that you can see how important that is when we refer back to the work of Andrea at ECPAT and the disrupting harm work. The many of the cases that are being discussed, and the increasing number of cases we heard about in Namibia are through, for example, Messenger, for example, WhatsApp and other platforms. So important the child helplines are also present on these platforms, and important to see that those technical intersections. In terms of a child helpline, what does it mean to a child? Child-friendly, confidential, anonymous, offers real-time support, counseling, can provide child rights information, and ongoing referral to other agencies. I'd like to describe the child helpline as the entry point into the system, connecting the different actors in the child protection system, a system that children themselves should never have to navigate alone. And then finally, and what we're focusing on a bit more deeply here, is the data collection. So almost as a byproduct to the work that child helplines do, is this amazing, unique set of data that is coming from every contact to a child helpline. And we'll share a bit more about that aspect in a moment. And I think I'm now going to hand over to my colleague Asha, who's going to take us through the next slides, and then we'll come back to some practical examples actually from our colleagues in Kenya. Thank you.
Thank you, Helen. So this is just some data from last year. So in 2024, our members around the world have received just over 7 million contacts from children and young people around the world. Out of those, they were able to provide support to about 3.5 million contacts around the world. So these would be contacts in which a counselor would support and assist a child and refer them to further support if needed. If you'll click on the next slide, Helen. Yeah, so this is part of the data that we collect from our members is about why do the children contact them? So what is the reason for the contact? So as a counselor supports the child, they can select an option or multiple options as well. Here on the left, you see the breakdown of contacts globally. You can see that the biggest or the most common reason for contact is around mental health. Second most common is violence, and then peer relationships, family relationships, etc. On the right, you see the same breakdown, but just for the African members of our network. And here you see a slightly different picture. So for the African child helplines, violence is the most common reason for children and young people to contact. And that could be any form of violence, physical, sexual, technology facilitated, etc. We do employ in our data framework and how we collect data, we try to align with the ICVEC, the international classification that Claudia has mentioned before. It is not as straightforward as it can be because child helplines collect data on so many different types of contacts, so not just violence-related ones. So we don't have the luxury of having that same level of nuance, but we try to align it so it is comparable on the kind of higher resolution. So violence is the most common reason to contact the child helpline in Africa, closely followed by issues with physical health and access to services, which could be things from legal advice or access to education or access to health services or mental health services. Maybe next slide is where I can talk a bit about how we use the child helpline data. So we use it and we see it as an opportunity to provide a snapshot or a kind of to measure the pulse of child safety, their well-being, their physical health, their mental health, etc. And it can be used to inform policy and response and give these really quite unique insights from their own children's and young people's own voices on the harms that they encounter both offline and online. As part of the work that we do, we have, like Helen mentioned in the first slide, we have what we call the core quality standards for child helplines, and this is a set of standards co-developed with the members, so the 9 kind of core standards of what does a child helpline need to be providing support in the highest kind of level to children and young people. some of the standards are relevant for data, and we've listed them here. So one is around the fact that a high quality child helpline should be collecting data on the contacts that they receive. They should be reviewing these data points, ideally monthly, but also quarterly, and kind of gloss over them to understand what are the issues impacting children in their context. Next one is to use these data to guide advocacy initiatives, their media engagements and campaigns to the public. And lastly, we'd like to see child helplines contribute to national policy legislation, whether it's through consultations or advocacy recommendations, again, based on this evidence that they collect. Thank you.
Thanks very much, Esha. And I think to continue on this vein, as you can see, the work we do is working with our members and partners around the globe. And as Esther has said, we work in over 130 countries. I've also put in the chat where we don't have members in West Africa, and I'd be very happy to hear from UNICEF country officers and partners in those countries so that we can follow up and connect with any existing services, or indeed start the process of starting up a child helpline. And I think it's important also to reiterate that it is quite a challenge for us to collect data on technology-facilitated child sexual exploitation and abuse, because children and young people don't always present and identify where the harms have taken place. And so often the presentation from a child can be on various issues, and it's really the skills of the counsellor to be able to identify these issues and be able to capture the data that we need to understand the prevalence of these issues. So I call back to the presentation from Namibia again, where we're building a partnership and building capacity and resources to be able to collect that kind of data. Again, I want to thank Miguel and the Safe Online team for their support in that area, where we're working quite intensively, also in terms of the public-facing campaigns that we heard about as well. And I've seen for myself just how effective those campaigns can be, and especially the creative ways that these have been done in Namibia. So moving on, I want to also mention that there are different intersections that Child Helpline International is working on. Indeed, as well as the disrupting harm research, which is very important to our members in those countries that are part of the research. We've been working with child helplines across Africa around different capacity buildings, around building the recognition of the child helpline as an entry point to report these kinds of cases, and also as a way to ensure there's a referral for the child or the young person or the concerned adult into the, for example, hotlines and other reporting portals. I think it's important to mention that there are quite a number of relationships at Child Helpline International that, from a systems-based perspective, are very important. And I think that the ICVAC presentation from Claudia was really pertinent in understanding how we use that information to include that in our own data framework, as Asha has mentioned. So these partnerships are incredibly important for us in terms of connecting all the different dots. I think that's very challenging in our sector, and it's very much part of our mandate to make sure that we, avoid duplication of different interventions and really help to ensure that children and young people have a one-stop place to go to when they have any issue in their life. Latterly as well, in terms of connections with tech companies, this is so important to work with tech companies because so many of the issues we see are exacerbated by the tech companies and the tech platforms. And, we can say a lot more about that. We could have a webinar on that particular topic itself, but we will be launching a set of principles and guidelines on the intersections between tech platforms and child helplines somewhere in the course of the next week, together with the Office of the Special Rapporteur to the Secretary General on Violence Against Children at the UN. So moving on with the slides, and I think you've had some chance to read the slide that's in front. I'm going to move on to other areas of our work, which I think are important for today. So I mentioned already the Safe Online funded project, which is called Voice of Africa, focused on 7 countries, actually in Eastern and Southern Africa. And also then a bit larger project, Voice Up Online, which is together with UNICEF, which is focused on building capacity, but also the specific issues around awareness of populations of reporting to child helplines. Again, of course, that's linked to the data that we can have available to share with partners and also to then feed back into programming. And then I want to also announce that Child Helpline International is a member of the recently launched African Task Force on Child Online Protection. We're really proud to join UNICEF and also the African Union and the GSMA in this task force. I'm very excited for the ongoing development of that mandate. I have a couple more slides, and I know time is running short, so I'm going to take you through some information from Kenya, because there is some good information to share from Kenya in terms of the national data that's collected by the Child Helpline. So Childline Kenya is founded in 2008, is running the 116 harmonized number, and is available via various web-enabled channels. And I think that the key thing to say about the data from Childline Kenya, because we've invested together with Childline Kenya and the government in very good data capture software, those specific data sets that are generated are used at national level to be uploaded to the CPIMS, which I think is a very important way to intersect and ensure that data interoperability is promoted. Also shared with government agencies in targeted awareness campaigns, which is helping to mobilize stakeholders. And I think that's specific to technology facilitator CSEA, where we lack data, it's really important that we use this data as effectively as possible nationally and regionally, and indeed globally. And also just to mention that the data from Childline Kenya is also shared regularly with the broader population through media engagements. So I would identify quite a lot of good practices in Kenya. A couple of key wins for Kenya in terms of the data that's been collected, shaping, for example, the National Act on Online Child Exploitation and Abuse, contributing to the mapping of vulnerabilities for the National Plan of Action to end online child sexual exploitation and abuse. And also then we can also see that country level programming and evidence in terms of that Child Helpline data is regularly analysed at the county level to identify high risk areas. And I think that's really important to mention, that the better we are at capturing the data and being able to understand where that data is coming from, indeed to specific levels like county levels in Kenya, we're more able to isolate specific issues that might be emerging. I haven't had a chance to talk about, for example, the impact of AI on our work, but we can say from the data, especially from the case material we collect, so the anonymized case stories that we collect from children and young people talk often about, for example, Nudify apps. They talk often about sextortion cases. They talk often about children report being groomed online through various apps. And I think that these are the anonymized stories that we can collect from our members, which are also very helpful in understanding impact on children and young people of online abuses. And I think it's also important just to share here, and again,
Thanks,
on the slide.
Helen, I'm really sorry, but we are running out of time, and if we want to hear from participants, you can close.
Yes, we're done. Thank you very much.
Thanks a lot, Helen and Anastasia. I really appreciate that. I think there's a lot to share, and you were pointing on an issue that is key, as is AI. But I hope, as I say, that we will have the chance to have more exchanges. And this is just the beginning. We did this year, but I think there will be more opportunities, I'm sure. Thanks a lot for all the data shared, for the examples from Kenya, and also the data shared by Anastasia. Now we will move to the last presentation, so please prepare your questions. We will try to be sure to answer all of them. If not, we will send the answers later. Now we will hear from Miho Yoshikawa. You know her because she has been in charge from Ghana of all the work on online and tech-facilitated violence. She's a child protection specialist working in UNICEF Ghana and before in other offices in Asia. So I give the floor to her in order that we have time at the end for some discussion. Thanks a lot to you, Miho.
Thank you so much, Esther, for the introduction, and good morning, good afternoon, good evening, everyone. I'm going to talk about Ghana's journey to generate and use data and for protecting children from online and tech-facilitated violence. And Esther, please feel free to come in and then stop me speaking, very common if I run out of the time, because it's important to have sufficient time for everybody to exchange ideas. So let me start with the country's context. And as you know, as some of you may know, Ghana is a lower middle income country with high level of multidimensional poverty. And multidimensional and more than 70% of children experience multidimensional poverty in Ghana, and with increasing regional disparities, inequalities among children and their families. And Ghana is also well known for its political stability. However, with some regions affected by emergencies, including northern regions affected by Sahel conflicts, Sahel crisis, and its spillover. And according to the 2021 census data, total population in Ghana is around 30.8 million, 8 million, with around 70% of individuals using the internet. So this slide is aiming to show you how Ghana has been generating data and evidence on online and tech-facilitated violence through various types of evidence generation activities, including research, studies, assessments, evaluations, as well as administrative data collection and hotlines. And I'd like to also highlight how Ghana has been engaging multiple stakeholders across various sectors, and as well as across different levels, national, regional, and global levels. So let me start with the circle on the left side. So Ghana conducted the Global Kids Online in 2019, which is the global research project implemented by UNICEF Office of Research Innocenti in multiple countries. And through this research project, Ghana was able to have a better understanding of children's experience online. And in partnership with Internet Watch Foundation in 2020, Child Online Protection Reporting Portal was launched by the Cybersecurity Authority, which allowed people to report online and tech-facilitated violence cases. In 2021, Social Welfare Information Management System, SWIMS, was launched and by the Ministry of Gender, Children and Social Protection. And SWIMS has been customized by Primero, which is an open source software developed for the child protection case management. SWIMS is basically a web-based system to document and report on the provision of integrated services for children and their families. And Ghana has been able to integrate online and tech-facilitated violence into SWIMS, and as one of the 7 primary protection concerns. This allowed for data collection and analysis on online and tech-facilitated violence through administrative data collection system. And in the same year, 2021, and Child Protection Digital Forensic Lab, which is the first of its kind in the region, and was launched by the Ghana Police Service. And then this allowed Ghana to receive deferrals from global NICMAC database. And basically, it facilitated the investigation of online and tech-facilitated violence, especially child sexual abuse materials. And in 2021, so sorry, let me start with this background info. So UNICEF Ghana was able to receive the support from Safe Online for the first project, which was implemented between 2018 and 2020. And then in 2021, Ghana documented the best practices, challenges, lessons learned, and from the project itself, and generated recommendations for the way forward. And in 2022, under the leadership of the Cybersecurity Authority and with support from the UNICEF headquarters and development partners, Ghana mobilized key stakeholders across different sectors and to conduct an assessment to measure how matured child protection systems and relevant sectoral systems in Ghana are in terms of the We Protect Global Alliance model national response to prevent and tackle online child sexual exploitation and abuse. And in 2023, the Ghana has also commissioned in partnership with the University of Edinburgh to on the study on drivers of sexual violence against children and young women, with online violence included within the scope. And then in 2021, assessment was conducted to inform the guidelines for child online protection, specifically targeted at industry. And last but not least, we were fortunate, as UNICEF Ghana was fortunate to get the support from the Safe Online for the second round of the project. and which is currently ongoing. And as part of the project, we are conducting evaluation to generate evidence. So Ghana has been using data and evidence in many different ways, informing overall strategic approach, for example, for the government of Ghana, UNICEF Child Protection Program, and also informing national laws and policies such as Cybersecurity Act and National Child Online Protection Framework, as you can see them on the right, and also key programmatic interventions such as integrated social services approach, which has been implemented by 7 government ministries to strengthen service delivery mechanisms to ensure that children, vulnerable children, including those at risk of and experiencing online violence, receive appropriate care and support in an integrated manner. And last but not least, data and evidence has been used to strengthen partnerships and resource mobilization. For example, we were able to design and develop evidence-based theory of change, and which has been used and for the Safe Online project proposals, and which I understand was highly appreciated and then led to the fundraising opportunity as well. And this is my last slide, and just sharing top 3 lessons with all of you. So integrating online tech-facilitated violence into various types of evidence generation activities is very important because we don't always have dedicated funding to generate data and evidence on this specific topic, right? And especially in this global financial crisis. And also leveraging on available data and evidence, and then to do like conduct deeper data analysis is also key. And second, convening multi-stakeholders and partners is critical to ensure national ownership and to contextualize findings, recommendations, as well as capacity building, increase the national capacity to use and generate data. And last point from my side, and strengthening administrative data systems is very important for data collection and analysis to inform programs, policies, and fundraising, especially real-time program adjustments. So that's all from my side, and thank you everyone for attention.
Thanks a lot, Miho, and thanks a lot for keeping to the time. Now we will have some time for questions. Thank you, because Miho has go all around. So we start talking about the importance of those data for policies, and she can come back to that with the example of what they are doing in Ghana. So I open the floor. We just have 9 minutes, but it will be great to hear from the participants. So if there's any questions for any of the speakers, please feel free to raise your hand and we will open your mic, because I haven't seen, all the presentations will be shared. There was a question on the chat. We always share the recording and all presentations. So in a couple of days, next week is too late, you will have all available. And please feel free to raise your hand or open your mic if you have any question. In case there's no questions, I would like to ask the speakers if you can share one critical point, just one sentence, or what you would like participants to remember from this discussion today. As I say, we have 2 discussions before. This is our 3rd discussion. And I think it's really important that we have an overall commitment regarding online and tech-facilitated violence. So if you can share just a sentence, please open your mic and go ahead. Thank you.
Thanks, Esther. I think that one of the key things from our side is to ensure that children and young people are involved in any kind of discussions and participating in the plans and programming that we have, especially at the national level, because they are the ones that are adopting technology. They're at the forefront of understanding how AI intersects with their worlds, and we can learn so much. We wouldn't want to make assumptions about some of their experiences. Thank you.
Thanks a lot, Helen. I don't know if any other speaker would like to share something. While we wait if there's any question.
Yeah, I think
Hello.
I can. Oh, sorry.
Yeah, go ahead, please.
Yeah.
Hello, good
I mean,
morning. Good morning, good afternoon, good evening to everyone.
Please go ahead. Completely.
Yeah,
Yes.
what I want to say is I'm very happy that this program is being organized to throw light on the activities that are being done. But when you consider the resources, being inadequate. I wanted to find out if it is possible. So agencies under the UN, such as UNICEF, UNFPA, among other things, if they could look at their programs, those that are similar in terms of the child issues, so they could put the resources together so that it can be channeled specifically towards that. Thank you.
Thanks a lot. I don't know, Miho, if you want to go in or if we'll need to.
Sure, I can maybe quickly come in. I think this is amazing points. Thank you so much for raising this. I think we just need to, for example, when we develop the project proposals, program proposals, like do we always take evidence generation activities into account? It's very important to include like already evaluation or some sort of documentation or assessment already in the project proposal development stage. So this is also a gentle reminder for everybody, including myself, to take it into consideration. And then we also have the joint programs, for example, with like various development agencies, partners such as UNFPA in multiple areas. And then, so we also consider like a resource constraints and then trying to leverage on the different comparative advantages and also technical expertise like each agency has. And I hope I answered your questions.
Thanks a lot, Miho. And just to remind also what Claudia was mentioned this morning, is the National Statistical Offices, and usually countries have more data on education or health, but on violence, we don't have enough data. So it's also an issue on how countries invest on having this data to have better policies and to include it since the beginning, as Miho was saying. So I don't know if there's any other question from the floor or if any of the other speakers. I know Andrea was about to share. Please, Andrea, if you want.
Yeah, I can. Sure. I mean, I agree 100% with what Helen shared about the importance of involving children and young people. And I also wanted to share that I think it's important that we don't use the lack of data as a reason to not already start addressing the issue. So, I mean, I'm a researcher myself. I think that data is extremely important, but I also think that it's not feasible to have data consistently and always updated for all the countries of the world. So what can we learn from the data that exists from other countries to already create system or amend system that respond to the issue that we are seeing? And as I was saying before, from disrupting harm now to where in the second iteration, which is in completely different regions, we are seeing many things that are similar, which are indication also that some of the responses can be already adapted for countries for which we do not currently have data. So yes to the importance of data, but not using the lack of it as a reason to not start action already.
Thanks a lot for this reminding, Andrea, and I think this is clear in our region. So in West and Central Africa, despite Ghana, Nigeria, little, but we are starting, there's no much data, but we know the issue is there. And as I was saying since the beginning, I think it's something important to take into account. We are talking about the youngest continent to be in the following years, and also a region where internet is penetrating really fast. So things are changing a lot and we need to take that into account. So even if we don't know, we know this is there because we know it from other countries and the reality and the numbers are giving us that the estimations probably will be that the impact of online and tech facilitated violence is growing a lot. So thanks a lot. And I don't know if there's any, I'm trying to see if there's any other questions. I'm having problems with I don't see any question in the chat. We are almost about to finish. It's 11:27 at least here in Dakar. So I will give the floor to close to my colleague, Lucia Soletti. It's a pleasure. She is the Chief Child Protection in UNICEF Ghana. She has been leading with me all this work, and it's a pleasure to have her here today to close this webinar. And just to remember everybody, we will share the materials we have shared for the previous two ones, and we will keep sharing those materials again for those that haven't had the chance to join. And as I say, this is a beginning, and I hope we can continue this change between countries even after this. I see the hand of my colleague Godwin from Nigeria. You have 1 minute, Godwin, because we're running out of time. So please, 1 minute to Godwin, and then we jump to Lucia to close.
Thank you very much, Esther, and thank you to the presenters. For us in the Nigeria Country Office, given Nigeria's population and given the level of internet access to children following the COVID-19 pandemic, which has risen quite astronomically, this is an area we are going to increasingly become more involved. There was an attempt to pass a legislation some 2 years ago by the Parliament, which we felt did not meet the requisite standards, and we mobilized stakeholders and made submissions, and that process was stalled. The country has already developed a child online protection strategy. We are then looking towards the inauguration of the Child Online Protection Technical Working Group, which will then guide everyone, both in terms of government, civil society, development agencies, to then develop a comprehensive work plan, so to say, towards getting a good legislation, and of course, working in terms of the regulatory environment, both with the service providers, to ensure that children in Nigeria are well protected online. Thank you very much. And we look forward to partnering with you and other countries that have done this to learn those lessons. Thanks.
Thanks a lot, Godwin. And that is what we are looking for, to keep exchanging, to keep learning one from another. And I think there's good examples in this region and in other parts of Africa from which we can learn and work together. More protected work also online for all children from Africa. So with no more delay, please, Lucia, to you for closing. Thank you.
Thank you so much, Esther. I would really like to appreciate all the key speakers for sharing their valuable experiences, and thank, of course, all participants for being here today, and also for the interactive discussion we just had. A special appreciation goes to Safe Online for their generous support and partnerships in making this webinar series possible. We know that understanding online risks and harms is essential to ensure children have safe and meaningful access to digital technologies and can fully enjoy their rights. Today, we learned that there are various ways to generate evidence through administrative data collection systems when we heard about ICVAC, but also helpline and hotlines when we heard about Child Helpline International, also providing very interesting examples from Kenya and how they have been using data also to inform programming, but also about research and studies and evaluations. More importantly, data and evidence should be used to inform effective policies, contextualize programs, show impact, and ensure accountabilities. I am confident that the collaborative spirit demonstrated during the webinar today and in the entire series of the 3 sessions we had since September this year will contribute significantly to advancing our shared goal of creating a safer online environment for children. We look forward for continued engagement and partnerships as we work together to strengthen efforts towards ending violence against children in West and Central Africa and beyond. Thank you so much and have a pleasant day. Thank you.
Thanks a lot, Lucia. Thanks a lot to all the participants, to the interpreters. Thanks a lot for all the speakers for respect the time. We have been able to do it on time also, which is not easy. We will share all the materials, all the presentations, the recording. As I say, we will reserve from the previous 2 ones, because I know there's countries, as they say today, also working on legislation. That was the issue of our first webinar, for example. And we will try to keep the contact of all of you in order that we will encourage other exchanges next year as we are approaching the end of the year. Please keep in touch with us if you need any further information. Thanks a lot again to all the speakers and to the Ghana Country Office for this wonderful work. Thank you.
Thank you, everyone.
Thanks, everyone.
Thank you.
Everyone, have a good day. Thanks.
Thanks.
Best wishes to everyone. Thank you.